Hi, welcome to IAN's Health Talk with Dr. Akram. I am Akram. In this program, we will be talking about all kinds of different health issues with different experts in the field. Today, we will be talking about autism and ADHD. So sit back, relax, and enjoy your time with us. Autism is much more common than most people think. There are around 700,000 autistic people in the UK. That's more than 1 in 100. People from all nationalities and cultural, religious, and social backgrounds can be autistic, although it appears to affect more men than women. Autism is a lifelong developmental disability that affects how people perceive the world and interact with others. Autistic people see, hear, and feel the world differently to other people. If you are autistic for life. Autism is not an illness or disease and cannot be cured. Often people feel being autistic is a fundamental aspect of their identity. And we're going to discuss another condition which is called ADHD, Attention Deficit Hyperactivity Disorder. It's a mental health disorder that can cause above normal level of hyperactive and impulsive behavior. People with ADHD may also have trouble focusing their attention on a single task or sitting still for long periods of time. Both adults and children can have ADHD. But first of all, let's look at these two conditions. What is autism and what is ADHD? Who gets them? How do they manifest? And what can we do for them and more? Let's welcome our specialist in the field, Dr. Shama, Parveen, MBBS, MRC, Psych. Dr. Parveen works as a consultant psychiatrist in learning disability in Sussex Partnership Trust. Hello, Dr. Parveen.
Hello, Dr. Akram. Hi.
Welcome to our show.
Thank you for having me.
Hope you're having a good day today.
Yes, thank you.
Okay. This is a live program, so call us on 0203 515 5788 if you have any questions or suggestions. Or write to us, healthtalk@intv.co.uk. And you can also follow us on Facebook Live, intv.co.uk. Okay, let's go back to Dr. Parveen. So how is the day? The weather is keep changing. One day we have 30 degrees, following day we have 15 degrees. How do you feel about it?
I'm staying in UK long enough to get used to it, to be honest.
Yeah, it's nice. It's quite unpredictable, isn't it? But
it is.
That's UK.
There is some lovely sunny days.
Yeah, we can't complain because we had few really good days earlier and it was really warm. So yeah, of course.
Absolutely.
Okay, excellent. Okay, thank you for being with us again. So because we had a really nice program last time, and I decided to do 2 programs, and let's discuss more about these problems, which is some people know about them, some people not much know about them. So let's discuss more in detail. Okay, what is this autism? What is the autism spectrum disorder is about?
Thank you, Dr. Akram. So we will be talking about autism spectrum disorder and ADHD today. So just wanted to clarify, because these are 2 different disorders, different issues. So it's better if we talk about autism and then, or we do one after another rather than doing 2 together. Okay.
Excellent.
So shall we talk about ASD or autism spectrum disorder first?
Let's start with autism. Is that good?
Brilliant. That's fine. Okay, so as you correctly said, autism spectrum disorder is a disorder and it is a lifelong condition. It is a neurodevelopmental disorder, so it is because of some abnormalities of brain. And it is a condition, and as you correctly said, it will be there throughout the life of the person. So I would rather call it ASD or autism spectrum disorder rather than calling it autism, because the recent classifications are sort of going most towards ASD because of the variations in presentations in people having ASD. Because it is a spectrum, it could be someone having ASD could be anywhere in the spectrum, and this is so broad, and each person with autistic spectrum disorder is so different. It is very difficult to sort of have pinpoint, especially like absolutely where on the spectrum they are.
So what you're trying to say is some people will have mild symptoms, some people have moderate, and some people have a severe autistic disorder.
Well, that is one aspect of it, but not only that. There are other variations as well. It's not only the severity of it, but the symptomatic prevalence as well. So some people will have some symptoms, prevalence of some symptoms. Some people will have prevalence of different symptoms.
Oh, that's right.
But they will all come under the spectrum, really. So let's talk about it. You kindly said about the prevalence, which is really, really high. It is more than one person.
I was quite shocking, I was reading, I was not sure about it. That's why I actually asked you before the program, is it right? It's
Absolutely.
1 in 100 or more than 1 in 100.
Absolutely, absolutely. So this is much more than people would think the prevalence of autism is really. So as you correctly said, because it is so prevalent, people should be more aware of it. And I will take this platform today to try to raise some awareness about autism. Okay, so what are the difficulties that people face when they have this disorder or condition, really? So to have a diagnosis, they will have problems or issues in 3 aspects. First of all is social interaction. The second one is communication. And the third one is restricted, repetitive behavior interests. So if we come from the first one.
Social interaction, yeah, that's what you said.
Absolutely, yeah. The first one is social interaction. So again, as I was telling you, that autism spectrum is a spectrum and people can have different symptoms. Based on whereabout in the spectrum they are. Some people could be completely aloof. They don't really bother what is happening around them.
Oh, right.
People may think that they are rude or they don't really care, but no, that's how they are. They're just aloof. They don't really bother what's happening around them.
Happening around them?
Yeah, because there is a theory that's called theory of mind, by which people understand what other people are thinking or other people's emotion. And one of the theories of autism says that people with autism lacks in theory of mind. So they don't really understand that the other person...
So it's not they don't bother about the other people, but clearly they don't understand about the other people.
Absolutely.
Oh, okay.
And that's how their brain is. That's how their brain function is doing. It's not that they don't care, but it's that because they don't really know, they don't really understand that other people has got feelings and emotions as well. So that's one type of it. Other person could be... interested about something and would be really interested to talk to people about that things. Some people may be into trains or aeroplanes and they would be really interested to talk to someone about that. But then when it is not about their interest, they just really would lose interest and not talk to someone.
That's true. I have seen as well a few times people with these conditions, they are really into something and they will go deep into the subject.
Absolutely. Usually people with autism find it difficult to make friends. So you can imagine it can be really difficult throughout their life if they find it difficult to make friends.
Yeah. People with autistic people, can they make friends with similar kind of illness, or will it be difficult for them to make friends even with themselves?
Well, it depends. Again, as I said, no 2 people with autism are the same. So we have to keep in mind.
That's a good point, isn't it? Yeah.
So I was saying, I was still talking about the social interaction bit. So some people can be totally aloof. Some people can be really interested in talking about things of their interest. some people can be really placid, and they can talk to someone if they are approached, and they are sort of drawn into it, but they usually don't make friends or start the conversation or communication. So as you can see, even with this social interaction bit, it can vary. It can vary with people with autistic spectrum disorder.
Can they have good friends? Will they have at least one or two good friends, or will it be still difficult for them?
Some people, what usually is seen is it is difficult for people to make friends just because they don't understand social norms. But they can have some friends and some good friends. That when, especially if they share the same interest, if someone is into train and the other person is into train as well, so they can have really good communication or good friends. But usually it's in their own terms, really. Maybe not the friendship you and I call.
Excellent. I think hopefully after our program we can make at least few people understand what it is, and they will understand the other person rather than the autistic person understanding us. We could understand them, we could go to their level and make friendship with them.
Yes, we can always try. We can always try.
Always try. I'm going to hold you there. There's a quick caller there, and let's see. Hello. Sorry, the caller's lost. Okay, we go ahead with the program, and he might come back again.
Okay. So the next point is communication. Yeah. So we've been talking about social interaction. So the next point is communication. We see that many people with autism has got severe problem with the language. Some may not develop language whatsoever at all. So some people just don't talk throughout their life.
They don't talk at all.
They don't talk at all. Some people will have some sort of language. Maybe they just pick some words from here and there, can use them, but not in a way that you and I are using. Some people can be really fluent in language. So again, you can see the variation here. If I can go a little bit back to our last week's program with intellectual disability.
Intellectual disability, that's right.
Some people with autism can have intellectual disabilities, and about 2/3 of people can have some sort of intellectual disabilities. So, and because of the developmental delays, there are usually language delays. But again, there are people under the autistic spectrum disorder, they will have fluent language, like you and I. But as I was saying, there would be some kind of difficulties or oddness, maybe we call it odd use or odd use of language, how they come across. There can be severe problems with eye contact.
Okay, that's interesting.
The issues that people with autism spectrum disorders struggle are to pick up the sign language, the body languages, the verbal and non-verbal cues that we use in our normal day-to-day talk.
True.
And some people will lack body language, and some people will have problems in picking up body languages. So it's more sort of expressive and expressive language. They can have problems in expressive language, and they can have problems with comprehension as well. So basically what happens is they can struggle understanding both verbal and non-verbal cues.
So they have problem with both verbal and non-verbal.
Verbal and non-verbal cues. For example, people with autism usually take things very black and white. So understanding the proverbs or the sarcasms could be really difficult for them, because they take everything, black and white.
They take it literally, what we say.
Absolutely, literally is the term. They take things literally, so they can be really sort of stressed out about the proverbs or, sarcasm, because they think that this is actually, people are just not being nice to them and saying things like that.
Actually, we have seen that as well in our friend circle. Some people, whenever you say something, they take it literally every word. They don't understand the joke or anything. I actually had, there was one of the colleagues who was working with me. She said she was autistic, but I couldn't realize until she said that she was autistic.
That is really interesting you say that, because many of the people, especially who are with the higher intelligence intelligence range, who are sort of holding job and having families and in occupation, they actually come for a diagnosis by themselves. They have sort of thought throughout the day there's something wrong with them, and they come to seek help, that what is wrong with me, and they get diagnosis eventually. Because it is, as I said, because of this, because there is so many variations, it's so very difficult to pick up, especially people with people with more able range.
That's right. Yeah, that's right. And there was another kid as well who was is one of our family friends, and he was quite normal, and the parents somehow picked up that he is autistic, and that was good actually, diagnosing the autistic, because then they have informed the school and everything. They have given him extra attention. He's doing excellent, brilliant. He is doing.
Absolutely. So where I was I was in the communication. So among these are the verbal cues. I said they take things literally, but the non-verbal cues, getting people's facial expression, they don't really understand what people are meaning by their facial expressions. Or the tone of voice, or as I was saying, they really sort of struggle to get the abstract concept of things. It's very black and white, very literal in their mind. So. Sorry, you're saying something.
No, that's fine. I'm just thinking about what you're telling. Yeah, that's interesting.
So usually people with autism actually do better if they get clear, short instructions.
So clear, short instruction, they still do better. That's why they need that extra time with studies, isn't it? And the teachers giving more attention to them, and that probably helps them.
Absolutely, absolutely. And the last point was to get a diagnosis. These are restricted and repetitive pattern of behavior, activities, or interest. As I was saying, that they can have very sort of restricted interests. People can be in train, and their life can sort of be around trains. They end up buying toy trains. They end up going to stations, watching trains. And so this is just one example. People can be so interested about a single thing, or it could be anything. It could be someone could be sort of get really obsessively interested about say for example computer. So this is a very restricted interest. There are repetitive movements as well. Some people can have, these are interesting because these are some of the things that parents pick up from a very early age. People can have sort of hand flapping movements, or nodding movements, or rocking movements. So these are the things that people can pick up. These are not normal, especially, sorry, yes?
They can't stay still, is that right?
Well, no, not that. That's something different. But these are like, you will see people doing like this, or tapping, or just sitting down and rocking like these. So these are the sort of repetitive or stereotype movements that we can see in people with autism. Also, people with autism can be really anxious about unpredictability. They really like to stick to routine. Because they don't understand the world around, they want to know their routine. They want to know the place they're in. They want to know what would be the environment they will be. So things like what they do after what. Maybe someone goes somewhere. They like to take the same route every day, and if there is any deviation from that route, it can cause them severe anxiety, which can end up into behavioral disturbance.
That's quite interesting. Yeah,
that's really, really interesting. Yeah. And these are the restricted interests.
So from behaviors. These symptoms, what you said, what are the points you would advise the mothers to be alert about when the children are small?
What are the sort of signs or symptoms that they can pick up, and then sort of or raise concern with the professionals to get a diagnosis? So if when the kids are really young, when they're babies, it's not many signs can be picked up, but parents reported that they always knew that there's something wrong with the kids. For example, someone may had inconsolable cries. It was very difficult to calm the baby down, or some sort of feeding difficulties. Someone may report that the baby didn't used to suck, or some baby could be just don't cry at all, even when they're hungry or anything. They just don't cry. They're just very good, placid babies. But as they grow older, you can sort of spot more signs and symptoms, especially if the parents have got enough to compare them with. They would know the difference. They can pick up the things like, the person or the child may not responding when they're called by name. The parents might think, okay, is the baby deaf? Is there any problem with hearing? But then they find out, if there is anything of their interest going on, maybe a special music that they like, or there's a special TV program, they actually turn to that. So it's sort of selective hearing. So these are the things that parents usually pick up. And then they can have some developmental delays. They can have problems with the eye contact. Some kids, when the adults are there to pick the baby up, they just really put the hands up to be picked up. So these are the early signs.
These are when they find these signs, what do they supposed to do? The next step, what can they do?
So absolutely, if the baby is very young, they can talk to the health visitors if they're still around. It's usually not diagnosed until the child is around 3 years old, because you need to know a lot of information about the child, about their social interaction, and up until a child is 3 years old, it doesn't really develop that way anyway in a normal child. So you don't really get a diagnosis earlier than that. Parents can pick up symptoms or signs here and there, but they don't really get to sort of get a diagnosis.
So the diagnosis is mostly clinical, isn't it? Like you look at the symptoms and signs, and there is no physical.
No, absolutely. So you can't really, unfortunately, have a brain scan or any scans or any X-rays or any blood tests to diagnose this. So it's
purely you observe
purely clinical diagnosis.
The person, and it can, as we said, it's a lifelong condition. It can be picked up late in adult life as well, isn't it?
Absolutely. Especially, I was talking about people who are more able on the able side. Who sort of, they might have seen that they have struggled throughout, but it's just not been picked up really. So yes, so what you can do if there is any concern, go to your GP. Usually, let me tell you, when these kids are usually picked up, they are usually picked up around the preschool age or around the nursery years, because that's when you socialize, you mix with your peers, you socialize outside your family really around that time. So that's when in the more severe end, along with other disabilities, children are usually picked up around that time, and then GP, the parents or teachers can sort of bring it up to
they bring GP. It up as well, isn't it? So
and then the GP can refer to the professionals.
Is that the age when they start going to school or preschool? That's the time they get picked up, most of them. So if they get missed, and they might go into adulthood and they be picked up later.
Yes. They usually, people get the autism diagnosis throughout their life. And I was talking to a parent recently, and she was telling me that I always knew there's something wrong with him, but unfortunately I didn't get a diagnosis until very late, because it's not very easy to pick up.
That's quite a good point. We'll come back because there's a video as well. We'll play it a bit later. But quickly, are there any treatment, any cure? But I said there's no, but I just want to ask you again from
No, there is no treatment or cure as such, but there are ways that you care for these people in a day-to-day life. The way you approach them, people like routine. People with autism like consistency. The way you approach them, people with autism like clear directions rather than giving them abstract or muddled instructions. Really, they like clear directions. They like to be in routine. It is difficult to raise a kid with autism. I'm sure if parents are watching, they know what I'm talking about. It's extremely difficult because their world goes around the autism, really, because some
Yes.
people with severe autism can have really a lot of difficulties with their day-to-day life and functioning. There's only one thing I quickly want to talk about very quickly if I have time. People with autism can have strange reaction to sensory sensitivities. It means the way we react to noise or lights or touch, it can be varied in people with autism. So they can either be hyposensitive or hypersensitive. Some people can have really hyposensitive to pain, so their pain threshold can be really, really high. Children with autism come back home with broken bones and without crying. So you can imagine how high the pain threshold can be. They can be really hypersensitive to noise, especially the background noises that we can ignore. If we are in a cafe, in a sort of crowded cafe, we can ignore the background sound and we can carry on talking. But this sort of background noise can be really painful. And anxiety-provoking to people with autism.
I have seen some kids, autistic children, walking around with parents and wearing this, heavy headsets.
The headphones, the big headphones. To protect from the noises. So I thought I will just mention, I know it's a huge subject and we don't have really that much time to talk about it, but I want people to be sort of cautious about that because the sensory things can be a big thing for people with autism because they can be sort of, some people can end up doing, if they're frustrated, doing self-harm behaviors like itching or picking skin and end up having a lot of infections and things like that. But they're just doing it to get some sensory stimulus that they need. So it is so important to keep in mind if you are someone caring for people with autism. But these are usually people with severe autism.
We'll talk a little bit more about autism, and I think we need to go for a quick break now. And after the break, we'll talk more about autism. Today, anyway, we're talking about autism and ADHD, two most important conditions in our society. And there are lots of children and adults who are affected with these conditions. And so far, we have talked a little bit about autism and how it manifests and symptoms and signs. And next half, after the break, we're going to listen to a video that's especially from one of my colleagues who has a child who is autistic and how his life evolved around him. And Dr. Parveen is going to talk more about, a little bit more about the autism and the treatment. We said we haven't got much and what we can do for them. And we touch upon the ADHD. And so be tuned to our channel. I will see you after break.